Hello, everyone. So my name is Martin Wiedmann. I'm a co-director of the New York Food Safety Center of Excellence, and welcome to this um, webinar slash roundtable on where we have four panelists that will talk to us about how AI is being used, can be used, and what to see as the future of AI in public health, and maybe more specifically enteric and foodborne disease surveillance. This is brought to you by the overall Centers, Food Safety Centers of Excellence. You can see a slide of them right here. And this is a network of multiple centers that are here to help you if you public health official in the US and whether it's state, local, tribal, public health. And this slide outlines sort of our main activities. So if after this webinar you have any interest in or need help or want further information, feel free to reach out to me or feel free to visit the website and connect with your COE. If you want to find the website, it's as simple as typing food safety COE in your favorite search engines, find the Food Safety Centers of Excellence. And maybe one of the more important pages there is what's called the All Products page, which is where we will also post recordings from these presentations. And so if you
Martin,
go there,
I just want to interrupt. I don't see your slides. I'm not sure if others are.
does anyone else see the slides?
I
They're
can see them
showing.
fine.
I see them. Yep.
Yeah,
So then it's a Madhu issue.
it's a Madhu issue. Yeah. So maybe it's in another screen that's hiding somewhere. So this is the COE All Products page. And that's where we will also put the recordings. So if you hit products, that's where you will find the recordings, but you will also find other products that might be helpful for you in your public health work. So with that, I want to introduce our panel today, and I'm gonna ask them to introduce themselves sort of alphabetically, and we will start with Madhu.
Thanks, Martin. So my name's Madhu Anand. I am the Regional Epi and Investigations Deputy Director at the New York State Department of Health Bureau of Communicable Disease Control, but I'm also the co-director of the New York Integrated Food Safety Center of Excellence.
Great, thanks, Madhu. Alan.
Hello, everyone. My name is Alan Dorsinville. I am the Director of Workforce Equity and Racial Justice at the New York City Department of Health and Mental Hygiene for the Bureau of Communicable Disease.
Great, thanks, Alan. Chuck.
Yeah, hi everybody. It says John there, but I do go by Chuck. I am a senior policy analyst at FDA's Human Food Program, specifically within the Division of Surveillance Strategy and Risk Prioritization. I lead a team of data scientists and public health professionals to make sure that FDA's limited resources are directed in areas of largest public health risk and working with our states and tribal partners to do the same.
Thanks. And last but not least, Josh.
Yeah, hi everyone. I'm Josh Rounds. I'm a foodborne epidemiologist with Minnesota Department of Health and also coordinate our Food Safety Center of Excellence.
Okay, so let's start with the first question. If you could, each of you maybe briefly describe how you're currently using AI or how the agency you work with is you using AI, or if you're not using it or barely using it, what are some of the barriers to use of AI in your agency or for you in your job right now? So I don't know, Josh, let's start from the end. You want to start us out a little bit?
Sure. So, we're kind of right at the starting gate still. I feel like, in the foodborne world, specifically at the Department of Health, we don't have any specific tools that have been developed by our agency for our routine work. Now, there are some tools that we're using that are built into Cedric. There's one that kind of looks at shopper card information where you can upload shopper card data and then find commonalities that way. There's another one kind of that looks at text. So there's some help from CDC at building tools, but not in the foodborne world at our agency. We've done a little bit of work. So kind of in the routine day-to-day, it's more of the what everyone is doing. It's like the fancy search that you're doing that can kind of provide more information quickly, but it's not the real powerful uses of AI that are being out there. So we're kind of still in the infancy. There's been a couple of projects in our health department in infectious disease that were interesting. There was one with our COVID group where they used AI to extract information from medical chart reviews about hospitalized COVID patients. And then, that kind of replaced some really intensive, it took about an hour per case person time to do that, that they found really useful. And then they kind of built a chat bot as part of that where you could upload the medical records and then interface with the chat bot and kind of ask questions, look for lab values, things like that. That would be more manually intensive if you're kind of reviewing the chart by yourself. And then our immunization record system kind of built a chat bot as well to kind of help folks navigate pages, hopefully reduce the amount of questions they were getting. So yeah, we're still really at the starting line. I feel like there's a lot of opportunities to use it, and we kind of need that institutional buy-in and guidance kind of from higher level to get down to kind of the frontline staff to be able to use it more effectively.
Thanks, Josh. Chuck, you want to go next?
Sure, thank you. Yeah, so it's always intimidating and maybe risky to speak for all of FDA, but I'll do my best. So obviously, that FDA regulates a lot more than just food, but I'll mostly focus my attention on the food safety area. But first and foremost, broadly, we also have kind of been progressive here. AI is rapidly evolving, and I think that you're not able to ignore it anymore. And so we started out, 6, 7 years ago, my team started with a very traditional application of AI in machine learning. And we've been very successful. I might go into more detail later if there's an interest. Basically applying all of the various machine learning algorithms to our past data, samples, inspections, exams, et cetera. We have a wealth of information, wealth of data. Some of it's collected by our state partners, and basically feed that into the machine learning models to predict violative samples or inspections moving forward. And so that's been very successful, and to the point where after a couple of pilots, we're implementing it and using it to a statistically significant degree to find more violations. But more recently, and maybe for some folks more exciting, has been this generative AI boom. So one of the big concerns was we can't just direct staff to go out into using these public tools like ChatGPT, because the information that you put into it is used for training those models, right? And there's some sensitivity with that. And so we've embarked over this last year to develop a platform called ELSA. It's basically an internal, behind our own firewall platform that is fed by different models. It's a multi-model kind of platform. You can choose a drop down and choose whether you want to use ChatGPT or Claude or Gemini, but it's all within our own universe. It's not connected to the internet for safety reasons, so that it's fed by the training data in the foundational models, but then we've uploaded all of our guidances, compliance programs, et cetera, into this tool to use it as like kind of a document library, if you will. And it's been very successful. 90% of FDA staff are using it more or less on a daily basis to help support their work. Yeah, you can summarize an email from your boss or help you write a publication, but it can also be used to do more advanced things. Like I just received a HACCP plan. I'm going to load it in. I'm going to share the HACCP guidance, and I'm going to compare those two documents and see where it's strong and where it has some weaknesses. So we're doing everything under the sun there to explore. But the big thing I want to share and maybe end this part with is it's always a support tool, and it's always a human in the loop. They're responsible for making the final decision. And we usually are advocating that folks use these tools, but also cite when they do use them to help with transparency and accountability.
Thanks, Alan. Anything to add? Any other examples you might have?
Yeah, I think I'll just add on to what Chuck had just mentioned because at the New York City Health Department, we recently created our own internal AI that is called Helix. And so that's only been around for about a couple months. And so the uptake for it is still a little bit on the slow side. But there is an inner work group of folks that are meeting on a regular basis to try to think of what are some use cases for this and also to try to collect use cases across our agency. I'll say for myself right now, usage might vary greatly because it's really based on people's individual familiarity with AI. And so not many folks are using it. But what I'm trying to do is I'm trying to become that bridge between those who have the technical expertise and knowledge of how AI actually works and functions, and those who are like the program leads who may not necessarily know how AI works, but by kind of like serving as an in-between between those two parties, trying to help them to understand how they might be able to utilize it in a way to expedite their workflow or use it to kind of fill in any gaps they might have. Um, Something else I'll quickly mention is that although generative AI gets a lot of kind of, I think, visibility, I do think that there is also a lot of AI use cases where things are just being done on the back end automatically. That could also have a lot of really potential helpful use cases for public health across the board. And so that's something that I think I'm also working with, trying to introduce some of the people on my team to, so that way, even if they're not necessarily interested in using it in some of the ways Chuck mentioned, as far as like the generative chatbot function, there are other things that they may be doing that could be like automated and done more quickly. And I will agree that it is definitely a support tool. So I also tell folks, or I use it for myself sometimes to speed up tasks that might take me days and do it in a matter of like hours and minutes. And I do think that is like a very useful way to use it. So that's all I'll say.
Thanks, Madhu.
Yeah, so I think I'm very similar to some of the other people on the panel today. So the department hasn't routinely been using it for our staff right now. Access is restricted within the department. Gemini has been disabled as well as ChatGPT for some of the generative pieces. However, the department really recognizes that this is something that we can't get away from. Everyone is heading in that direction, and they're trying to figure out how to appropriately incorporate utilizing generative AI for the department. And so there is a pilot program that we've started. And it's very similar to what Chuck and Alan were talking about, where it's internal only. It is based off of Gemini, and we have a number of individuals that are in the pilot group, some from within our bureau. And there are different ways that they can try to test out the system, whether that's uploading raw data to try to analyze it, or to summarize an email, or to summarize a document or article that might be out there. So I think the department is really trying to move forward and determine what those guide rails would be as we're using it. Um, I think there's the case of all of us potentially using generative AI on the side when we haven't been able to utilize it at work. But maybe for some of those critical things like coming up with a creative title, or revising a non-identifiable, a paragraph that doesn't have identifiable health information in it to be maybe more grammatically correct. We too have been exposed to it within Cedric, and have had some tutorials on how we might be able to analyze our shopper card histories a bit better. I think that, we've realized that there's still a manual component to all of these, and that we have to help define the model as it's going along. So may not be as simple as just uploading and having it analyzed. But that's kind of where we're at right now. I think the department is actively working towards setting up an official policy on how it's going to be used.
Thanks, Madhu. So a couple of things. If anyone has any questions, please just add them into the um, the box for the chat box. Now I want to follow up on one thing. So Alan, you said you are using Helix. Is that based on ChatGPT or Claude or something else, or is that something completely newly developed or specifically developed at the New York City Department of Health?
Yes, it's built on top of ChatGPT.
Okay. And do you know what makes it different from ChatGPT, or what did you do to sort of make it your own, for lack of a better word?
Yeah, I'll speak to it as best as I can, but what I believe we did was we used ChatGPT as the foundation for it, but then we built on top of it so that way, similar to like what Chuck was saying, we can add our own data to it, and it could be held within our own, internal server, if you will. So that way that information is not going back to any external companies or whatnot. And so that's what we pretty much did.
So I think, summarizing, and all of you correct me if I'm wrong, is the trend is definitely trying to come up with these generative AI tools that are internal, where a lot of the concerns about, data breaches or, data going out are addressed. Josh, where are you guys in Minnesota with that? Do you know?
I believe there's a work group looking at it right now, but we haven't developed our own model yet. And I think that will be the route that folks go. But, right now we're with Madhu, we're kind of using it on the side. We're not restricted in that we can access it, at work. But it's really up to the individual staff to make sure they're using it appropriately, which can be a big challenge.
Yeah, it's actually interesting to see already, right? The range that is out there is from you can use it at work without restrictions. And next step two seems to be to shut you off all of generative AI and then slowly bring it back on as an internal AI with some either restrictions or improvements on it. That's at least how I see it as sort of a summary, which I think fits with what I've been sort of hearing otherwise. So thank you for that. So we heard a few specific examples of how you use it, like shopper club cards, analyzing them came up a few times. Chuck brought up some examples about, comparing Hassenplug, for example. Anyone else of you have any other specific examples? Ideally tangible, what we learned from these webinars. People want to know, okay, how can I use it today, potentially, or at least use in the next few months? Anyone else have any good examples of how it can be used, just to help the people who are in here see how they can use it in their daily professional life?
So I can pipe up. I know that there are some staff members who are using our internal one that are part of the pilot group that are using it to help with coding a little bit. So it can, it can help them troubleshoot some of their coding.
Yeah, I think that's a great example. Thanks, Madhu. Anyone else, anything they want to add?
Yeah, I'll share a use case that's kind of compelling. We're still in the pilot stage here, but it kind of combines multiple parts of AI, so generative AI and also computer vision. So, exposing the computer, the model to an image and asking it to interpret it. So one of our big challenges, and we often need to work with the states on this, is defining what the active inventory is that we need to regulate. Who's producing food out there in the world, domestically and abroad? And are they worth our regulatory effort and oversight? Are they operational? Are they high risk? Are they doing a volume of production that would make them, have more exposure to the marketplace? And we often run into what we colloquially call washouts, where we go out and inspect a facility and it's no longer in business, or maybe it's moved, or it's been bought by a different company, and so we had the wrong name. And somebody was just there last week, and they went to the other one. So, we really want to try to avoid that, and again, maximize our resources. So we're starting to use these AI tools to basically complement what the humans are normally doing, which is a painstaking process of Googling a firm and their address, trying to see if they have active posts on Facebook, or if they've recently paid their taxes, or if they're registered in, Minnesota, or whatever it might be. But if you multiply this by tens of thousands thousands of facilities domestically and hundreds of thousands abroad, it's really challenging. So we're starting to think about how we can upload our own information, again, in our own firewall protected environment, and ask the model to go out into the internet and search for these facilities and let us know and give us a confidence interval and with some evidence and links to that, whether that firm is active or not. And then we can look at our own information. When were we last there? What was the compliance history, et cetera? And then we can use that to prioritize. We could give it a kind of a viability score, if you will, to prioritize what needs our oversight more. And in a perfect world, we would be sitting down with every state and reconciling inventories and all of this. But this is one way we can do this kind of globally as a first pass.
Thanks. That's a good example like that. Anyone else want to add anything? And if something else comes up during this conversation, you can circle back to this. So next I want to talk a little bit about, barriers, and we already sort of mentioned some of them, maybe more sort of indirectly. So what do you see as major barriers, either now or within the next, 6 months, 9 months, for improved or AI implementation and use, or for enhanced implementation and use? And if someone wants to jump in and get us started, that's fine. Otherwise, I'm just gonna call on you. So anyone want to get us started? Josh, what do you see as sort of barriers?
Well, kind of from our limited experience, right? It's that that buy-in from the institution to kind of get the resources down to the frontline staff. There's the specific pilot projects, and it's kind of in this current public health environment with reduced resources, uncertain funding. I think it's hard for a lot of state and local health departments to kind of go out there and try to do new things, where most folks are treading water right now and not really thinking about how to get ahead of this.
Now that's a good one. So institutional buy-in and just overcoming, the challenge. Some of it's inertia probably, right? And some of it is just getting people to just do one more thing. Madhu, what are your thoughts on barriers?
Yeah, so I think one of the things that really strikes me, and I think was mentioned by Chuck as well, was that we have this vision that AI can be infallible sometimes. And I think from the previous webinar, we talked a little bit about hallucination. You and Luke talked a little bit about hallucinations, and AI can fall short sometimes. It can make mistakes, and there's always a need to have that human there for quality checks. I worry that, we sometimes take it as gospel, and especially the new students that are going through really need to be trained in how to look at it critically, make sure that anything that's being produced is leaning back towards primary sources, and that we're really, still being able to think critically as to what it's producing and does it make sense. Humans, definitely sometimes maybe take a longer time. I think AI is great in that it can help us be more efficient, but there's also still always needed that quality assurance piece.
Chuck, anything to add?
Yeah, no,
On
these
barriers?
are great points that are raised. You've probably all been there when a light bulb goes off, you used AI, you've challenged it to do something, and it comes back and gives you a very, very strong answer very quickly. Maybe you even went one step further and validated it. And let's just say to be positive that it was right? I've done that recently with some statistical analysis, and then I checked it on my own, and it was right. It got it. Now a lot of these tools now, they heard the hallucination issues that were happening, and now they call Python and they run their math in Python, and then they bring it back into the tool. You don't see that, right? And so if there are AI skeptics out there, I would say challenge it, use it to do something, then you can validate it yourself, but also ask it to show its thinking. You see these in some of these tools, you can toggle that on and off. And it's fascinating how it goes back and forth and is talking to itself and comes up with that answer. Recently, I just had a presentation from a colleague who developed a tool that you ask the tool something, it's a chatbot, and it asks that same question to all of the chatbots that are out in the world, and then they fight with each other and they do a kind of a peer review analysis before coming up with that final answer, right? So when the chatbots win their battle, you win is kind of the mantra there. Also, I'll say that, technically it's not hard to use these tools. The new programming language is English, you might have heard. So people don't need to learn how to code per se, but I think you have to know how to ask the right question to the tool. So the prompt engineering piece, how to structure that prompt, and then how to verify it on the back end. And, like we espouse here in FDA, you need to be accountable. It's your responsibility to check the results of that. And so, I think that one other thing that I see a lot of weakness with these tools is they don't have the context, right? They're very good at looking at a database and answering that question, but maybe there's a food safety event in a nursing home that is small compared to a food safety event that is larger in the general population, but because it's a nursing home, we know that it's more of a public health impact, right? But the AI might not know that. And so providing context in our models, putting that into the prompts, or always having the human kind of, ground truth that, I think is a really important practice.
So I think to summarize, I think as you said, some of the barriers are just sort of the perception of hallucinations will always happen and AI is more often wrong than right. And there's some things you can address it, right? And I think another one is sort of maybe the lack of training and prompting, which then relates to that, because I think depending on how you write the prompts, you can reduce those risks if you do that right. And I think that's something where we also, particularly for the COEs, that's helpful because we probably do need to help people with some training on prompt engineering to reduce some of those risks. So that's also part of the goals of this webinar, is for us to find out how can we support, public health officials at all levels with AI. So thank you. That was very useful. Alan, anything to add?
Yeah, I think everyone covered a lot, so I'll just add a little bit and saying that I did think that, the people are definitely going to be part of the limiting factors because you're, in addition to just being able to prompt engineer, I think you also understanding how AI works is also really important because then you understand its limitations and you understand that it is, it's trained on data that may have been biased, or we all know how data can be incomplete. And so if we just continue to build on top of whatever data sets we have available to us without interrogating that data set, that original data set, and seeing what blind spots may exist within it, it may continue to unintentionally perpetuate certain outcomes. So I think just having that context as well as for not just how to use AI, but how AI works will help you to be able to identify whenever certain limitations may come up or to be at least aware of them so that way you can fill in the blank and add in that context and always be kind of thinking about what things may be missing from this. And I will also just quickly say that for me, since I do a lot of coordination with a lot of different parties, I have not necessarily seen any kind of like project coordination AI task or AI platforms or models, but I do think like, AI is a one-to-one kind of relationship right now. And so I do think that when you are working with a team of people, if there is some sort of way to kind of bridge everyone's work together, or at least communicate in one shared space, that is something I think could play a really big role in how this might look in the future moving forward.
I'm happy you brought up the issue of bias because I think that's an important one. Any advice how to proactively address that or minimize the risk? Knowledge is the first one, just understanding that it is a risk. And, we're all biased in one way or another. But I think any tips for that? Any advice?
Yeah, I mean, I will say this is a question that we're actively thinking about ourselves. So while I don't have any like perfect answers yet, I do think again, so we sometimes create these models that we use to kind of make sure that we're asking ourselves certain questions, almost like checkpoints, if you will, throughout certain processes. And so I think if you wanted to even just include that in your prompt or in the context or in the background of whatever systems you create, you can then try to account for it to some degree on the back end, or at least as the user, you can always put that into your prompt and into your context to at least make your AI aware of it. And I personally will sometimes put in questions or prompts into the AI to see what kind of responses it gives, just so that way over time I can kind of track how does it match up to some of the things that I would consider or say myself. So I do sometimes just spend time kind of like testing AI and seeing how it might match up with things that me or other members of my team might come up with. But I think it does need to happen on a more systematic level, and I would have to be a little bit more informed on like the data training process in order for me to say more.
Yeah, thank you. What an important point. I'm surprised a little bit that no one brought up that, not having data accessible in digital format as a barrier. We work in food safety with companies, and that's a huge barrier there. Is this an issue? Is this a barrier, or is AI the solution to that barrier? Just buy a giant scanner, I'm somewhat joking, and feed it all in, and AI figures it out. I mean, is that a challenge in public health? The availability of the information in digital formats.
Yeah, Martin, I'll tackle that one right away. I think it's the solution. Do you know how many food inspection plans we have in a PDF and reports in a PDF that we'd have to ask an intern to look at them for months just to extract, something out of 100 of them. Now we can feed them all in. They're roughly in the same format. You can give it the AI and it can extract a lot of things very quickly. So we found a lot of success in our internal platform where you can upload documents. And actually, we had two things. You could upload your own documents, or you could, have a document library of FDA guidances. And we found that everybody said they wanted the AI to be trained on the internal guidances, but what people actually are using is they're uploading their own documents and asking questions of those, much more than the other stuff. So this is a big need, and you can upload an image, you can upload a PDF, a document, and extract a lot from it, and then use it to ground your work moving forward. So I see this as being you can kind of throw everything in, kitchen sink approach, and then ask it to extract things out. But you always have to validate it. And when you have two databases that don't talk to each other, then all bets are off.
Thanks. Anyone else want to add anything to that? Or okay, we haven't gotten any question yet, so for those of you who are listening, feel free to add some. So I'm going to change maybe topics a little bit. We'll move on to sort of how AI will impact public health and the public health workforce, but also, what are some of the skill sets that people that go into public health or are in public health may need to work on to be able to use AI more efficiently? Anyone want to start us? Alan, what do you think? I mean, it seems like you described it as one of your challenges to get people to start using it. How do we get there? What
Yeah,
are the skills that people need?
I was just about to actually raise my hand. So I do think that, for me, I think actually curiosity is one of the biggest skills that we need to generate, because once you have something that can kind of do like the hard skills, if you will, I think soft skills start to come into play in a sense. And I do think that with AI, you are limited by your creativity in a sense, where if you ask a weak prompt or a weak question, you're going to get a weak response. But if you're someone who is curious about the data that you're working with or curious about the problems that you're trying to solve, you can potentially come up with some pretty impressive outputs with AI. And so I think that generating curiosity is going to be one thing. And I also think that as far as like how it might affect public health as a whole, I do think that at least for some agencies, we may be limited in terms of resources or just the amount of administrative tasks that we have to work on. And so I think things like generating reports, coming up with summaries, those things that just take up so much time and can come up last minute and can get in the way of working on other priorities and things. Those things will be done more quickly, allowing our staff members to work on the things that we deem to be more important, if you will. And I think it'll also allow us to create, have more time to potentially ask more research questions, ask ourselves, what's the possibilities with the data that we already collect? And then one more thing I'll just quickly mention is that I do think that as we tend to become more advanced with AI, although most people will probably see us moving more online, I think a lot of our offline interactions are going to actually become a lot more important in the process, as perhaps people start to seek out more in person or people first kind of like interactions and things. in case there is some sort of like backlash or we move too far with the AI trend. And so for those reasons, I do think like community outreach and things like that can play a significant role here. And I think the possibilities for health education are also significant because the biggest challenge we've always had is how do we communicate these things and translate a lot of this public health jargon into something that the everyday person can understand. But now you have a technology that can explain things to people in their own language. Like it's something that can talk back to you. And so now if someone doesn't understand something, they can always put it into an AI chatbot and ask it to constantly break it down until they're able to understand it. And it could also help us on our end in terms of like creating communication and messaging that we think will actually make sense to people and not just the everyday person, but also the policymakers and also the other decision makers that we work with. And so that was a little bit of a broad ranging answer, but those are some of the things that I think about because my role kind of wears so many hats about how AI and public health might kind of go together.
Thank you, bro. Some really good points. Um, Josh, Madhu, anything you want to add?
Yeah, tying it to kind of more closely to kind of foodborne, how can it replace some of the repetitive day-to-day tasks that free up some human resources because we are in this environment where public health resources are not expanding, and free up staff time to tackle kind of those more interesting or challenging questions. And ideally, can this reduce some barriers that people have when they're doing outbreak investigations to ask those questions and do those analyses that maybe they were intimidated by previously? A big area that we are trying to push is ingredient-specific analysis. Get down to that specific ingredient that's causing the foodborne outbreak in the restaurant or wherever. And there's some barriers to that if you haven't done one before with coding, other aspects of that. And I think AI could be a great resource in breaking down those barriers and making people more comfortable doing that. So hopefully, in the ideal world, we're able to spend more time on kind of the more important work, more challenging work, and able to get kind of better outcomes in our investigations and kind of better results.
Yeah, thanks. Madhu, Chuck.
Yeah, so I think you had mentioned how do we get public health or uh the enteric workforce there. I mean, I think these pilots that are happening in all of the states is a great first start. I know for our pilot, it does require a pre-training, but I think just kind of continuing learning some of that language behind AI. I mean, I've learned so much even in this past month, as these webinars have been going on, and prepping for today. So I think that's really important. Martin, you know very well that, the Centers of Excellence hosted a whole genome sequencing webinar series a number of years ago. And I kind of feel like AI is in this moment that's very similar, where we're all learning the language and the concepts behind it. And it's going to take a few times and some application and then rewatching and relearning some of that language again to make sure that we have those methods kind of grounded. And then in addition, I think as Josh was mentioning, there's lots of opportunity to not only help us focus on some of those questions that we maybe haven't been able to get to, but also be able to help with, for instance, source identification, getting there more quickly, like having more faster hypothesis generation, getting to source identification more quickly, and then being able to focus on some of that education and prevention again.
Chuck, I think you haven't weighed in on that question. I'm going to rephrase it, maybe throw you something in. So if you were in charge of hiring someone or recommending hiring, would you write job descriptions differently today than you would have, let's say, 3 years ago? Would you put in something about AI skills? What would it be? Or something else? Or maybe it's like, hey, you got to be able to travel 80% of your time now because you don't need to do desk work anymore because AI is doing it all for you. I mean, what more on the practical side, what do you think is changing?
I love that question, and I will weave in my other prepared response about the future with that one. So I have hired a lot of folks, probably 30 folks over my time at FDA. And most recently, we hired a data scientist, and we had an interview where we said, here, go to this public repository of FDA data and develop a model or the plan for a model that would predict a refusal upon import. And this person and other candidates really went for it and put PowerPoints together and even downloaded the data, cleaned it, made some models and presented some preliminary information. That was enough for us to know that they are truly data scientists, and they in return understood that this is the kind of thing that we'll be asking of them on a daily, weekly basis. That was 3 years ago. Now, I don't really care so much that they can code. I like, Alan's response about curiosity. You have to be fearless in your desire to go and use these tools and see what they're going to produce for you, and quickly jettison the ones where it's not useful at that moment and keep the ones that are, and then return back to it, because these models are improving. They're doubling in their capacity every couple of months. And so if it didn't work before and you were discouraged, it may work in the future, right? I don't talk about hallucinations very much, and I don't see it happening in my work because these models have addressed that. So I would say folks that take initiative, that are curious, but more than anything else, you have to care about public health. You have to care about food safety, because then you could just go and use AI to sell people chips, right? You could go into industry and do that. Why are you doing this? That's what's going to keep you at the job. The tools will change, the techniques and the culture will change. But if that is a driving within you, then I think that's what's going to keep you around. And so that's why I keep working in this, because I now can do more public health work with these tools than I could before. And that's, I think, what's really exciting.
Thank you. And I'm just going to pile on to your question about hallucinations. The people that work in our group here, whenever they cringe every time someone, whether it's in a publication or in a presentation, someone talks about hallucination and how we can't use AI because they all say there's 1,000 ways to fix that. Got to get with the program here because this is an old excuse. And it reminds me of the old days of whole genome sequencing, where everyone was like, it's not standardized enough, we can't use it. And they were saying that for 5 years after it was standardized enough. So I do think there's some lessons to learn from other technology adoptions. And I thank you for bringing that up because I think it is important.
Just one more point that you just spurred for me. Every resume should have an AI section. What have you done and know about AI? Because if you don't have that and you're kind of a newbie at this, it means that you're not willing to explore and be up with the times, right? So if you're an epidemiologist, you should have a statistical section. You should also have an AI section. In fact, my daughter's middle school has said nobody can use AI. And I think that that's really a disservice to them and their growth. And so this spring break, I've actually asked them to go on an AI exploratory course with me. We used AI to come up with it. So every day they have a couple of tasks, how to do prompt engineering, how to take a picture and analyze it, these kinds of things. They need to know how to use this technology and when to use it.
Yeah, that's a good one and a big debate, right? What you do in the schools with AI and not. So I'm gonna have one specific question came in. Are there any efforts to build agent skills and almost SOPs for AIs to standardize workflow? Because if you might have, particularly at FDA, but even else departments, you might have 5 different people that are essentially doing the same, asking the same questions. And there's a high chance that everyone's approaching it differently. And there could be a lot of synergy and even more confidence maybe in the responses if there's, how are you approaching that Chuck? And then I'm going to rest.
Sure. Yeah, thanks. I realize I might be taking more of my time than I deserve. But
No, don't worry, I'll cut you off.
Okay, you can cut me off anytime. Great question. Agentic is the kind of the new flavor that I think is really here in AI. So think about asking one tool to do one task. Now you ask something and you put some context in it, and that main tool goes off and asks different subtasks to do it, right? And they go off and operate independently and come back. And that main one is called the orchestrator AI. So what we've done is two things. One, in our online platform, probably the second version of it, we introduced workspaces. So basically, it's kind of like SharePoint rooms or whatever. So you can develop your prompts, and then you can add people to it. So everybody has access to the same documents, and they can ask questions of it in the same way without having to redo it. And that's one step towards, being able to collaborate better. And then our newer version of ELSA is coming. It's going to be more agentic. And so there's going to be tools where you ask a specific thing and a specific agent goes and retrieves the document. One analyzes it using, the guardrails that we've put in place for Python and math. And then there's a third one that kind of, analyzes it and responds back to you, right? And so I think we're trying to move in that direction. Nothing is completely automated. There's always a human in the loop, but we're trying to take advantage of what's going on out there in the industry, so that it can be most beneficial to FDA staff.
How about you, Alan, since you have the tool Helix, right? I mean, do you have sort of help for people that might use it so that you don't have 5 people trying to do the same thing but using different prompts?
Yeah, we're actually working on that right now. We don't have it up and running yet, but I think one of the goals is to eventually try to find some sort of system to kind of collect these prompts because, to your point, if everyone's trying to do the same task, but people are getting different results because they're using different prompts or one prompt might give a better result than another, that can just lead to a lot of different unnecessary um work on each person's end. So what I've done personally, at least within my bureau, is that I've kind of created just a shared document where everyone can kind of post their prompts and share them with each other. But I do think that one of the goals, we haven't gotten there yet, but one of the work goals of the work group that we recently created at the health department is to try to start collecting these prompts and use cases so that way we can create some sort of central question bank, if you will. Or
Thank
prompt
you.
bank, I should say.
Thanks. So we're gonna do 180 from geeking out to the practicality back. So outbreak investigations, and Cassandra, thanks for posting the recent MMWR article, which was one of the first one, or maybe the first one that sort of had some description of how AI was used to help with an outbreak investigation. So Josh or Madhu, whoever wants to go first, how do you see, people using AI very practically during outbreak investigations? What are the opportunities there? What can people do? All right,
I mean,
Josh, you go. All right, Madhu, you go. Go.
I was going to say, I mean, I think there's lots of opportunity, right? From reviewing the interview data that may be potentially coming in, although you have to be careful with that, right? Because you do want that to be in an internal system, especially because there might be identifiable information and maybe even stripping identifiable information before you're feeding that into a model, but kind of having that review, doing data analysis, potentially helping with hypothesis generation, which I think the MMWR kind of highlighted. I think it talks a lot about how a lot of us conduct hypothesis generation and literature searches now. And now we've got additional tools to help us with that. I think it can also help us with that education and prevention piece. Whether it's helping us develop imagery or data visuals that can then lead to being perceived very well by the public or targeted to certain populations. So I think there's opportunities for a lot of use there. I also think that it also may help us with some of those control measures too. We've talked a lot about, Martin, in our work as a COE, about targeting areas for sampling, but then also because when we find it there, then we can also target areas for cleaning or what control measures might need to be put in. And so I think there's that opportunity too.
Josh.
Yeah, just to add what Madhu was saying, I think providing that context for the outbreak, depending on what the specific pathogen is, understanding the history of that strain is something that's really crucial for investigators. So, put a plug in for the New York COE Surveyor Wiki. Resources like that can be really useful, and so AI can play a role in that, kind of combining information from different data sources, so you kind of get that context as you're going in. You can think about where have we seen this strain before, making sure we're asking those good questions on our hypothesis generating interviews, and then echoing like the coding assistant, helping you do that data analysis piece, and maybe overcome those barriers to coding that you have. It's good for data visualization pieces as well. And I think, as an epidemiologist, not having as much expertise in the environmental health world, but I can see AI having a great use there, with inspectors within the restaurant, kind of identifying, both historically, what are the issues that have been found in this restaurant before, and as they're going through, identifying what could be root causes for the outbreak. We haven't talked as much about the environmental health world kind of in restaurants, and I think there's a lot of resources that could be developed there too.
Thanks. So Alan and Chuck, based on your titles, I'm assuming you're not as much in the trenches of outbreak investigations as Josh and Madhu. Do you have anything to add to that topic before we move on?
I'll just share one thing that we've been, battling with, is how do you predict the next outbreak? And it's not the same as predicting a violative sample, because with the violative sample, you have both positive and negative outcomes that are confirmed in the lab. And so the model can learn, hey, think about your confusion matrix. The model predicted a violation. It was not a violation. It will learn from that the next time we train it and rerun it. But an outbreak, there are many outbreaks out there that go undetected. And how do you know what is the false positive, false negatives of all of these, right? So it's really challenging. So what we're kind of thinking about now is using AI to help support an outbreak response and investigation, like was just mentioned. But I would love to, make outbreaks not a thing anymore, right? And so where we've landed is, let's at least predict a violative sample. There was micro contamination in this product. We prevented it from going into the marketplace, or we prompted a recall. We'll say that we prevented an outbreak potentially. So that's where we've been spending our AI bandwidth on prevention, so that there are less outbreaks that we have to deal with.
All right, so we got about 8 minutes, so we're moving towards sort of a wrap up, more or less. So I want to, along those lines, any things people should be aware of, worried about, pitfalls, problems you have seen that people could avoid, and then if you're at it, because we might not have enough time for 2 rounds, maybe some sort of advice, where can people find more training? What would you recommend? We already covered some of those, but let's start with Alan. You want to start? Any pitfalls you have seen, how to avoid potential problems, and what do you recommend for people as we move into this future that's already half here?
Yeah, so fortunately I haven't seen many pitfalls, but again, I think the thing is that AI adoption is still on the early end if you think about it. I think I saw about a third of Americans maybe use AI on a weekly basis, but that doesn't still speak to how in depth they're using it. And so I think that the best thing is just really kind of increasing AI education and literacy amongst our staff. So that way, once the technology does reach a point where we can maximize it, I think we want folks to be ready for it versus getting ready once it's arrived. And I think also, to me, the best thing you can do is just practice. And even if you're not actually putting the prompts in, I think just thinking about how you might want to use AI to prompt certain things or to speed up certain processes, like just that process of constantly thinking like that, I think is going to get folks in the place of being better prompt engineers, better than just kind of doing a one-off training. I think you have to actually kind of go through that process yourself of like seeing and reiterating and whatnot. So those are the only things I could really mention. And I do listen to one person named Sinayed Bovell. And for me, it's just more so I listen to her so that way I could get an understanding of like how AI works and where AI is trending. So that way I can kind of anticipate it. And I guess one last thing I'll just throw out, because again, from my title, workforce equity is part of my work. One of the things that I do think about is like for those who are self-driven, how can they use it to enhance their own careers and whatnot? Because initially the challenge may have been that you didn't have access to a course or we didn't have the grants or the funds to fund certain things, but now you have something that could essentially become any expert you ask it to be. And so now you have someone you can bounce ideas off of, brainstorm with, use as a mentor in some instances. Of course, all of this has to be done responsibly, but I'm just saying that to say like the potential for AI is very wide ranging.
Okay. Josh, problems, challenges you've
Y-
seen, warning signs,
Yeah,
and future.
I think one of the big challenges for me is just the pace of change is so fast of what's happening out there. And like Chuck mentioned, agentic AGI now, or AI coming out, and that that changes things a lot. And we're still playing around with the chatbots and not, we're falling kind of further behind. And so it's hard knowing enough that you're knowing how far you're falling behind kind of as an organization and where we're at. And I think one of the opportunities here, though, is can we learn from how this is being implemented in the private sector in academic institutions that are maybe moving faster, and maybe avoid some of the issues that they're running into and implement it in a better way in kind of our organizations. So that's maybe a hope. But I think echoing what Alan was saying, I think the biggest barrier is just getting people familiar with it, getting them using it, having a space where you can kind of share just, within your smaller group, your smaller part of your organization, share how people are using it, because you'll learn a lot from each other, how someone approached this problem and found a use for AI, whereas maybe you wouldn't have thought of that. So kind of learning from each other, I think, is a good space, and maybe an opportunity for the COEs to kind of bridge that gap for a lot of state and locals that don't have a lot of staff in their organizations.
You worried about confidentiality, that people, if the tools are available, or some way they put data in that they shouldn't have?
I'm sure it's happening, and it's a big challenge. I think that's why a lot of organizations are going to that system where it's on your own servers and you're not sharing the data outside, because if you don't have that and people are feeling like they need to be using AI, there's a lot of temptation to use just kind of your online Claude chatbot and
Right.
put data in there, and unless you're very careful about looking through that data, make sure there's nothing that's identifiable in there, you could have an issue.
And I think that's probably a call for action for healthcare. Like you can't wait forever with this because people are going to use them. And the question is, are you going to help people use it responsibly? Or are you going to risk them use it irresponsibly? Madhu.
Yeah, so I'm so glad you mentioned that, Martin. I think that's the one thing that um, it has slowed government down, is because there's that concern about sharing confidential and medically sensitive information on individuals into a public AI, um, is something that's super concerning. And I think when we think about, initially we might not think very much about it if we're asking to summarize data, but that data then no longer is in the confines of the Department of Health's HIPAA and all of those aspects. It's out then, and it's the AI's kind of domain, and they can do with it as they like. And so we have to make sure that those protections are still available. I do think that, hearing about so many different jurisdictions having their internal AI programs makes a lot of sense when we're starting to talk about that.
Thank you. Chuck, I think you haven't weighed in on this topic yet. You got the last word.
Okay. Thanks, Martin. Thanks, everybody. 2 points. I don't want to retread ground here, but I am worried. My pitfall is my concern is bias. All of the data that is feeding these AIs and is making it come up with these magic answers is created by us in our own biased way, right? And we have to constantly check that, and this bias can be very nuanced. And, the point about, oh, we identified more food safety issues here. Well, maybe that's because there's a socioeconomic status there and there's poorer nutrition, and it's not necessarily the vector. It's just, it manifests itself there. And we could be pointing our fingers in the wrong places. So that is a very important thing that I would hope we would build into our prompts and have it check and do all of those things. The other one, I absolutely agree. It's about industry and what they're doing with it. And you can have a company and you can have AI write your HACCP plan and it can look perfect and exactly match guidances, but are they actually implementing it? Do they understand it? And I'm thinking about my European colleagues, which do a lot of audits based on paperwork, less in person, and FDA is very much practically in person kind of thing. And that's going to become more valuable, as was said, the human interactions. You got to cut through the noise and the fluff and the perfectly generated HACCP plans to understand, do they really get that concept? And until we have robots in these facilities doing that stuff, it's going to be humans, on the ground doing that. And so there's always going to be important work here. We're not going to stop eating because of this, right? And so there's plenty of space, for people to grow and have jobs in this sector. And I would hope that they continue to find that career path.
Well, thank you, and thank you all four of you. This went super fast. I had a lot of fun. I really appreciate it. I hope everyone listening found it useful too. And we may come back to you to do a sequel of it because there's a lot of other questions we had that we didn't get to. So thank you all. And for the listeners, this will be recorded. You will get a link and you will be able to share it with your colleagues. Thank you and have a good rest of the day.